Hello everyone, I am Hanz Shelley Dal and I am going to demonstrate on how to assess the head and the neck. Hello ma'am, I am Hanz Shelley, your nurse for today. What is your name and age ma'am?
I am Carol K. Dal. I am 19 years old.
Ma'am, I am going to assess your head and neck, that includes your head, hair, eyes, nose, throat or mouth, and lymph nodes. So the purpose of this examination is for me to determine your health status and identify any issues that may become medical concerns in the future. Okay, do you have any questions, ma'am?
No.
Before I am going to assess you, ma'am, I have to close the curtains for your privacy and sanitize my hands, okay? So, first, ma'am, I am going to inspect your hair and head. Is it okay if I touch your hair and head?
Yes.
So, first, ma'am, I am going to inspect your hair and head. Is it okay if I touch your hair and head?
Yes.
So, now I am going to wear these clean gloves. And I'm going to get a pen light. So there are no dandruffs or lice, no lesions and scars. So the head size seems to be normal, and there is a normal distribution of hair. So now I am going to palpate your skull and just tell me if you feel any pain. Do you feel any pain, ma'am?
No.
It's good. So now I am going to assess your face. So your face seems to be symmetrical. Next, I am going to inspect your eyebrows. So there is a fair distribution of your eyebrows. And there is also a fair distribution of hair in your eyelashes. So, ma'am, can I touch your face?
Yes.
So both eyelids are normal and symmetrical. So, ma'am, could you close your eyes for me? And now open it. Okay, so the patient has no trouble opening the eye, and the eyelids are covering the part of the sclera. So now, ma'am, I am going to proceed to checking the constriction of your pupil. So I have dimmed the lights, ma'am. So I'm going to check your eyes again, and I'm going to shine a light. Is that okay?
Yes.
First, I'm going to get my pen light. So now I'm gonna check your eyes again to shine a light. Subject right there for a moment. So both left and right pupil are constricting, so both are normal. So now, ma'am, I am going to check your pupillary accommodation and your convergence. Okay, ma'am. So focus your eyes on this ball pen. Okay, so both pupils are constricting. So the next step, ma'am, is to read the Snelling chart in front of you with your one eye covered. Okay, you may start, ma'am.
EDFCZP.
Okay, try it with another eye.
EDFCZP.
Okay, so the patient has a normal vision. Now I am gonna inspect your ears. Okay, so the size of your ears, both of them are normal. So there are no abnormalities or swellings or lesions. So now, ma'am, I am going to inspect your nose and I'm going to palpate. Okay, so there are no abnormalities. Now, ma'am, we are going to occlude your nose with your finger and breathe through the other nostril. Try it with the other nostril. So do you have trouble in breathing?
No.
Okay, so the patient can breathe perfectly normal. Even side is occluded is normal. So now, ma'am, I am going to check your frontal and maxillary sinuses. So there are no swelling and pain as per the patient. So now let's gonna move on the mouth. And for assessing the mouth, we have to wear the gloves. So I'm going to palpate the temporomandibular joint. Open your mouth and close. Do you feel any pain or tenderness?
No.
Okay, good. So first, what we are going to do is we have to inspect the lips, making sure they are nice and pink, that there is no sore in them. So since her lips are nice and pink in color, it indicates that her oxygen saturation are in a good level. So now let's inspect the inside of her mouth. First is cranial nerve 12 or hypoglossal nerve. All you have to do is to stick out your tongue, move it side to side. As you can see, she is doing it at ease, and that is a good indication. So now I am going to inspect the inside of her mouth using a tongue depressor. So open your mouth for me, and I am going to look the inside of your cheeks. So there are no sores or lesions, which is a good indication. So now, can you please stick out your tongue for me? Now lift your tongue. Lift your tongue, please. Now, can you put down your tongue for me? So I see that your tongue is moist and pink, not a beefy red, not cracked and dry, and I see no lesions. So now I am going to look around inside and check for cavities. So okay, I am going to look around inside and check for cavities and broken teeth. Okay, good. And now I am going to look at your ovula and use again this tongue depressor. So I can see that it is nice in midline. So now I am going to test the cranial nerve 9. Now what I wanted you to do is to say ah. I can see that your ovula is going up every time you say ah. And then I am going to check the gag reflex. So I am going to poke a little back there. Okay, so your gags are really good. So I'm gonna palpate your forehead to the posterior triangle of the neck. Do you feel any pain or tenderness?
No.
Okay, so good. So the next thing I'm gonna do is palpate your lymph nodes. All sides of your lymph nodes, will you please face in front of me as I am going to palpate right in front of your ears. Then go back. And then go to your occipital and right under the chin. And then your anterior cervical. So your lymph nodes are fine. Okay. So next, I am going to palpate the carotid artery and palpate individually. So I'm going to feel in this side and the other side. So I can feel they are both nice and pumping. So the last step is I'm going to use this stethoscope, the both sides, if I can hear a brewy or squishing sound. Okay, then breathe and out and hold. And now you can breathe normally. So I'm going to repeat the other side. So breathe in, out, and hold. Okay. So they are both normal. So now that I am done with the head and neck assessment, so your results, by the way, are perfectly fine. There are no abnormalities, sores, and lesions. So now I am going to take off these gloves and sanitize myself again. So ma'am, that would be all. Thank you for your cooperation and have a good day.
Okay.